Hi People is pleased to present 40 Days 40 FinTechs, an initiative under its Include Everyone program, as it continues to lead the way in advocacy for the creation and dissemination of technology that enables financial inclusivity. The 40 Days 40 FinTechs is shining a spotlight on those that are breaking down digital barriers and bringing millions more on the continent into the transactional space and transforming their lives for the better.
Paylater is a flexible, affordable, and convenient fintech helping low and middle-income earners to prepare for and afford quality healthcare anywhere at all times. We derived the word Paylater from pay later, meaning that if you request for a medical loan from Paylater, you can pay later in installments at your convenience. Last year, Daily Monitor ran a story of a pregnant woman, Anita Mishimana, who walked to Chitwe Health Center 4 in Intungamo and delivered at the health center gate because she could not afford to pay 50,000 Uganda shillings. When you look at the insurance penetration in Uganda, it stands at only 1%, leaving over 44 million Ugandans not insured. At Peleyta Health, we enable our users to save as low as 500 Uganda shillings, cumulatively dedicated for healthcare. And this fund can be used to offset their medical bills or buy medicine at registered healthcare facilities and pharmacies. And in case or in situations where this fund is not enough to offset their medical bills, they can request for a medical loan, and we do a micro top-up on their saved funds. They can also ask to make a fundraiser so that their friends and family can support them. Or a colleague can share a medical fund or a Paylater fund from their account. That is what we do at Peleyta Health. Our product is digital at the moment. It is all digital, so you can a user or our client or anyone can go to our website, or they can download our app Peleyta Health. The registration is very, very instant and very quick. So you register. After registering, the information, we don't ask a lot of information. When you create an account and you start saving there and then. And in case you're sick, or maybe you have an emergency, you can go to any of our registered healthcare facilities or pharmacies to buy medicine. We officially launched this year, and so far we have over 100 users, plus over 20 healthcare facilities that have registered with Peleyta Health. We're going slow but sure, and we believe that in a year time we'll be really very far. Our clients have wallets where they save their funds specifically for healthcare, and those funds can be used to pay for their medical bills or buy medicine, and the whole process is cashless. It is electronic. That is how we're using FinTech in our e-health or our health tech startup. Our process currently is only digital. We haven't yet gone to USSD, and we have a push payment model. We have a push payment model that facilitates immediate fund transfer. When we have a new client, they go to our website, they create an account with Peleyta Health, and they start immediately create an account. They start saving instantly. They can either it can be either cumulatively or set an auto save to start saving either daily, weekly, monthly, specifically for healthcare. And if, for example, they are sick and they go to our registered healthcare facilities and they are treated, the process of paying their medical bill using the saved funds is very simple and very quick. They'll put in a code for our healthcare facility, and then a payment will be made to the registered healthcare facility. We really plan to expand to more healthcare facilities across Uganda, because we started from Uganda and the progress is really well within the healthcare facilities in Western Uganda. The fintech industry in Uganda is really picking up, and I think the biggest challenge that we are having currently is on the transaction charges. Yeah, the transaction charges are very high, but we believe maybe as it picks up and grows so fast as it is doing, maybe there was going to be a huge change. 40 Days, 40 Fintechs is a really good initiative that we believe is going to transform and shape the fintech industry in Uganda, especially for, I can say, for maybe for the e-health or the health tech startups. We believe there's going to be a lot of inclusiveness, and we believe, for example, like Paylater is going to have is going to have a huge impact in partnership with 40 Days, 40 Fintechs, and we believe that we're going to have a lot of partners in this program when we go through this program of 40 Days, 40 Fintechs. To find out more about us, you can visit our website Paylater.com or www.paylater.com, and it is Peleyta, Peleyta Health, and we derived Paylater from the word pay later, which literally means that when you request for a medical loan from Paylater, you can pay later in installments at your convenience.
40 Days 40 Fintechs is presented in proud partnership with Cross-Lake Technologies, Modus Box, Modular Foundation, and Level 1 Project.